child looks sad and depressed, and when you ask them, they say that they are, but they don't know why. Their teacher is saying their grades are falling. You ask your child, and they tell you that they're struggling to concentrate. The child is getting mood swings, and when you tell them that, they become angry. You don't know what to do. You feel helpless. What you are observing is the behavior or the symptoms of some underlying issue. The underlying issue could be emotional or developmental or both. Ignoring the root of the issue and just dealing with the behavior is like putting a bandage on a wound. Identifying the root of the problem and healing the wound will likely result in long-term and effective change. Underlying issue that is leading to the behavior that you are observing could have biological, social, and psychological roots, or a combination of the three. Developmental issues refers to delays or anomalies in the typical development or developmental milestones across the age span. And usually these issues are present at birth and they continue through the lifespan of the individual. So under the umbrella of developmental issues, you would have things like autism spectrum disorders, dyslexia, learning differences, attention deficit disorders, Down syndrome, psychomotor regulation issues like apraxia, dyspraxia, and so on. Emotional issues can stem from a combination of nature and nurture. Nature meaning certain traits in the child's personality that the child is born with, which can be enabled or disabled by their environment. The environment of the child begins from the womb of the mother, and then after birth, immediately after birth, the first few years of the child are critical in terms of its development, especially when it comes to the attachment that the child develops with the caregiver, which is also known as the attachment pattern. A disruption in the attachment pattern or some kind of impairment can again have long-term consequences for the child. Added to that, traumatic events or illnesses can also result in long-term consequences. A combination of these factors or one of these factors can result in behavior changes, in relationship issues, issues with self-esteem, attentional difficulties, procrastination, sleep problems, self-regulation issues, oppositional behaviors, personality disorders, and so on and so forth. As you can see, human psyche is very complicated. There are multiple layers that have to be looked at and peeled in order to get to the root of the issue. And when the behavior is getting out of hand, when a pattern of, let's say certain responses from the child that are out of the ordinary, when it exists over a long period of time or a sufficiently long period of time, then action is necessary. Now, I often get asked by parents about what kind of a therapist do they need to see. So when it seems that there is a possibility of developmental issues, then I would recommend going to see an educational psychologist or a clinical psychologist, an occupational therapist for sensory issues or for psychomotor regulation issues, and a developmental pediatrician for autism spectrum disorders, and so on. To the emotional issues, then there are a few options available. So the more traditional approaches include talk therapy, and the more non-traditional approaches would be something like the mind-body approaches, which could be expressive arts therapies, art therapy being one of them. Then there is somatic experiencing. There are other mind-body approaches which are more mindfulness focused. My advice would be not to just focus on managing or targeting the behavior, but also to look at what is causing that behavior. Yes, you want to go see a therapist who, for instance, can teach the child skills to manage the behavior or to address the behavior or the pervasive anxiety. And perhaps a therapist, so this would be a therapist who knows how to, so this would be a therapist who is able to, within their practice, use some kind of a behavioral approach. The therapist needs to be able to also peel the layers from the past and maybe go a bit deeper into the history of the child, whether to look at any kind of trauma or the attachment pattern or any illnesses or changes in the child life that may have resulted in the symptoms and the behavior that is occurring. So ideally, you should go see a therapist who is able to target the behavior, but also what may be happening in the subconscious or the unconscious of the child.